blank page 1, blank page 2, blank page 3. All right. Hand sanitizer. Hello, my name is Hunter. I'm going to be your student nurse from SCSU today. Can you give me your name and date of birth?
Skylar Jablonski, 2299.
Okay, and then do you know what year it is?
2025.
And can you tell me where we are?
My house.
Okay. So you are ANO times 3, so I feel comfortable going further with this assessment. Are you allergic to anything? Oh, okay. So what we're going to be doing today is a head to toe. We're going to be going from the head down to the toe. It is exactly how it sounds. We're going to be doing an assessment to assess that all your body functions are functioning properly. Normally we go from the head to the toe, but what I'm going to do today, after a set of vitals, I'm going to go from your fingertips up your arm to your shoulder, and then head down to your toes. Before that though, I do have a couple overview questions just to ask you quickly. First, do you have any past or current medical diagnosis?
No.
Do you have any past surgeries?
No.
Any relevant family history?
No.
And then do you take any medications?
No.
Any herbal or vitamin supplements?
No.
And then these are a little more personal questions, but just to ensure you, I just wanted to ensure you that HIPAA is in full effect, so anything that happens in this room will stay in this room. If at all, how often do you smoke? This includes cigarettes, vaping, and marijuana.
I don't.
And then if at all, how often do you partake in alcohol consumption?
I don't.
Okay. And then how often do you exercise?
4 to 5 days a week.
Okay.
30 minutes a day.
Perfect. And that lines up good with the CDC recommendation of 150 minutes per week, 30 minutes a day. How is your diet? Are you getting enough to eat, 3 meals a day, adequate food group consumption?
I would say so, yes.
Yeah, okay, perfect. And then on a scale of 0 to 10 today, are you in any pain? 0 being no pain, 1 being a little pain, and 10 being the worst pain?
0.
Okay, perfect. I know after those questions, I again feel comfortable moving on with assessment. So we're going to start off with a quick set of vitals. First, we're going to do your blood pressure. Do you have a preference on which arm I do? Perfect. Okay, so I'm just going to slide this on. So you're going to feel a little bit of tightness with the sleeve here. Is that comfortable for you?
Yeah.
Okay. So what this is going to do is just going to tighten around your arm, and I'm going to slowly release it. And I'm just going to get some numbers from it, and then I will tell you what those are momentarily. So now I'm feeling for your brachial pulse. Brachial pulse is right there. I'm going to be listening with my diaphragm. And you can just sit still and breathe normal. Blood pressure is 118/70. That is within normal range, so that is good. Thank you. Next, I'm going to get a pulse from you. Can I just take your arm? I'm going to be feeling for your radial pulse. I'll be listening to this for a minute. Good. So your pulse was at 68 and respirations were at 14, both within range. Any pulse, which is your heart rate between 60 and 100, is good. Any respirations between 12 and 20 is good. So next, I do not have a temp probe. So are you feeling any abnormal chills or coldness? Any abnormal sweating or heat flashes? I'm just going to feel your temperature here. Temperature feels normal, so I would assume that your temperature is at a normal range of 98.6. Next, I'm going to check your SpO2 range. I do have a SpO2 pulse ox. But before that, I just want to look at your hand. Just looking for any clubbing. So that's going to be a sign of poor oxygenation to the tissues. I do not see any signs of that. Fingers look good. Before I give you that back, just going to slip this on for a pulse ox reading. Pulse ox is 98, so that's with the normal range. Normal range is 95 to 100. Closer to 100 is better, so you are good there. So that concludes our vitals. That concludes our vitals, so I will now move on to our assessment. Again, I'm going to start with your hands, work my way up to your head, and then move down. So could I just see your hands again? Feeling for muscle tone, temperature is good, muscles are symmetrical, looking for any abnormalities in the skin. I do see you have a tattoo. Did that heal up good?
Yes.
Any pain or any issues with that?
No.
Okay. And then again, I'm not seeing any abnormal lesions, moles, or rashes on the skin. So nails are painted dark, so I'm just going to check your cap refill on your first knuckle here. So cap refill is less than 3 seconds and symmetrical, less than 3 seconds and symmetrical, less than 3 seconds and symmetrical. So cap refill is good. So cap refill is just checking perfusion from the heart to your extremities of your body, so that is adequate. Next, or before I move on, I'm just going to, as I'm doing this, could you just lift your shoulders for me? Good, and that is feeling for cranial nerve number 11. We'll get into the rest of those once we get to the assessment of your head. Next, we're going to do a little bit of range of motion exercises. Could you just hold your arms out like this and then act like you're lifting weights? Good. And then do you know how to swim?
Yep.
And if you just make one full motion forward and then backwards. Good. Felt smooth there. Forwards with the opposite arm and backwards with the opposite arm. Good. Next, I'm going to have you do the opposite of what I'm doing. So could you just push out for me? Push in while I push out. Push down while I push up. Push up while I push down. Good. And then last, could you just twitch your wrist for me? Opposite way. Good. Okay, and then we're next reading into our cerebellar function. Could you make an OK sign? Next finger, ring finger, pinky, back, and now as fast as you can. Good. Next, can you put your hands on your thighs, flip them over, back, now as fast as you can, flip. Good. And then the final cerebellar function test is going to be nose to pen lights. Could you put your finger on your nose, pen light, nose, pen light, nose, pen light, nose, pen light, nose, pen light. Good. So that was the conclusion of your arm. Oh, before we actually do that, I do have to check your radial pulses for strength and some symmetry, as well as your brachial pulses. So feeling for your radial pulses here. Strong and symmetrical. Brachial pulses towards your elbow. Strong and symmetrical. Okay. So now that has concluded your arm assessment. Range of motion looked good. Your cranial nerve number 11 was good. Skin was good. Tissue perfusion good. No clubbing. So next we're going to move into the head assessment. I'm going to start with a inspection of the scalp. I do not see any dry skin here. And here, while back here, I'm going to feel your occipital, lymph node, any pain or tenderness there.
No.
Okay, then I'm just going to inspect this side. Everything looks good there. Next, I'm going to get into the ears. So I'm just going to feel them. Let me know if there's any pain or tenderness with those. Anything there?
No.
Just going to inspect inside that ear. Slide that out of here. Good. I see you do have earrings. Any pain with that or trouble healing up when you first got them?
No.
Okay. So next we're going to continue with our lymph node assessment. So I'm going to feel your post-auricular here, pre-auricular, submandibular, submental, cervical chain, and then could you hunch your shoulders like this? That's your supraclavicular. While I'm here, you can go back to normal. Gonna feel for tissue turgor. Tissue turgor is non-tenting, so I'm saying that you are hydrated. No signs of dehydration. All your lymph nodes were non-palpable and movable, so no concerns there for an infection. Next, we're getting into your sinus cavities. So again, let me know if there's any pain or discomfort when palpating these. I'm going to feel your frontal. Good there.
Yep.
Maxillary.
Yep.
Good. Okay. So that was all of your lymph nodes as well as your sinuses, and then we went into your ears as well. So cranial nerve number 8 is going to be your auditory as well as your gait and balance. So since you're responding, I'm assuming that your auditory is good. We will finish the gait and balance at the end of the assessment or towards the end. Next, I want to get into your eyes, which are going to be cranial nerves number 3, 4, and 6. So first, I just want you to look at my badge. I'm just going to assess combination of light. Good. Now I'm going to do individual accommodation. Good. If you just look up a little bit more for me. Good. Okay, both eyes were accommodating. I'm just going to inspect them now. Look down. Good. Look up. Good. Sclera is white and conjunctiva is red. Final, or 2 more tests for the eyes. We're going to do the 6 cardinal fields of gaze. So I want you just to follow my pen line and not move your head at all, just your eyes. So we're going to go up to the right, up to the left, down to the left, down to the right, to the right. Good. And the final one is going to be accommodation to far and near sight. So you're going to look at the pen light. Now look at my hand, pen light, hand, pen light, hand. Good. So that was assessing cranial nerves 3, 4, and 6. So 6 are movements laterally. Yes. And then I just mixed up lateral and vertical. Mm-hmm. And then cranial nerve number 4 is down and in. So we assess that with 6 cardinal fields of gaze. And then cranial nerve number 3 is eye lids opening and closing as well as pupil reactivity. So your eyes are perla. They are round, reactive to light as well as accommodating. So all of your eyes check out good. So that's cranial nerves number 3, 4, and 6. Cranial number 2 also goes with your eyes, but since we do not have a Snellen chart, we cannot assess that at this time. Next, I just want to go into your nose assessment. So could you just tilt your head back for me? I'm just going to take a peek in there. Lift up a little bit. Mucous membranes are moist, so that is good. And then I did not see any deviated septum or polyps. So we're going to test cranial nerve number 1 now. So if you could just close your eyes, I'm going to waft something in front of you. Let me know what you smell. Just a moment. Okay.
Honey.
Perfect. So cranial nerve number 1 is good. So now we've assessed cranial nerve number 1, 2, 3, 4, and 6, as well as half of 8 and 11. So now we will get into the cranial nerves number 5 and 7. So cranial nerves number 5 is a sensory and motor. So it's going to be a sensory of the feeling on your face as well as the motor of the movement of your jaw. So to begin, could you just close your eyes and tell me where I'm touching you with my pencil?
Forehead. Cheek. Nose. Chin. Upper cheek.
Okay, so your sensory checked out good. Next, could you just clench your jaw for me? Unclench. Clench one more time. Good. So cranial nerve number 5 is good. And then now to test cranial nerve number 7, which is your facial expressions. Could you smile, frown, puff your cheeks, and then make a surprise face? Perfect. So cranial nerve number 7 is intact. So now we have done all cranial nerves except for 9, 10, and 12. getting into the cranial nerve number 9, so this is going to be the movement of your mouth. So could you just open up, and I just want to inspect everything. I'm not seeing any abnormal redness. I do see you still have your tonsils. I do not see any white in there, so no signs of infection. I see that your teeth look good. Could you lift your upper lip up? Good. Lower lip down. Good. No sores or anything like that, and your lips are symmetrical and moist. So cranial nerve number 9 is good. Next, we're going to check cranial nerve number 10 and 12. So I'm just going to suppress your tongue down here with this tongue suppressor. You're going to say ah, and I'm going to check the reactivity of your uvula and your gag reflex. So say ah. Good. And then could you just stick your tongue out for me and move it side to side? Good. So that was cranial nerve number 10 and 12. So that will conclude our cranial nerves until the later stage of our assessment where we'll reassess cranial nerve number 8. So now I've looked at your head, your ears, your eyes, your nose, your mouth, and then your face movement and sensory and your jaw. So now I'm just going to get into your neck here. I'm going to check your trachea alignment if it's midline, palpate your carotid pulses, and then auscultate for bruits. So if you just sit forward for me, I'm going to feel I'm going to feel your neck. Trachea is symmetrical and midline. I'm just going to palpate your carotid artery. Good. Palpate on this side. Good. So now I'm going to auscultate. Again, I'm going to use the bell of my stethoscope. And then when I say, could you just hold your breath momentarily? Hold your breath. You can breathe again. Now we're just going to move to the other side. Hold your breath. Good. I did not hear any whooshing, so no signs of bruise. So that should complete the front end of your assessment. So we went over all your questions, and then your arms, your face, your head, your eyes, nose, throat, mouth, ears, and then your neck. So now I'm going to move on to the back side of you, and I'm going to assess for your thyroid gland. So what I'm going to do is I'm going to reach around, move your trachea to the side, I'm going to ask you to swallow, and do the same to the other side, and then we'll get into our lung assessment. So I'm going to reach around with my right hand, move your trachea, could you swallow? Good. Do the same thing with my right hand, move your trachea and swallow. Good. I do not feel any distension of the thyroid glands, so that would give me no cause of concern for hyperthyroidism. So next I'm going to move my camera over, and then we'll get into the lung assessment so you can stay tight. Just move this out of the way. So I'm just going to move your hair to the side. Move your gown. So I'm inspecting the neck. Skin looks good. Temperature of skin all around looks good. Palpating for your ribs and spine, for your shoulder blades, and then your spine are. And then symmetry is good. A to P ratio is 2 to 1. If it was 1 to 1, I'd be more concerned if you had asthma or emphysema, because that could be a sign of barrel chest. I'm not seeing any accessory muscles used for breathing, so I'm not concerned with demand of respirations. So now I'm going to go ahead and place my hands here. If you could just take a deep breath. So that just showed me symmetry of lungs, inhaling and exhaling, and then also where the bottom of your lung lobes would be, so that when I am palpating and auscultating, I'm not going too far down where your lungs are no longer at. So to begin with this, I'm just going to move your hair one more time, just like this, so I can get an even amount. I'm going to first percuss 6 spots on each side, going in a zigzag motion so that I get each side and compare it with the other. And then I'm going to do the same for auscultation. So while percussing, I'm going to be listening for resonance. If there was any dullness, especially in the lower extremities, I would be more concerned for fluid buildup in the lungs. And if I do hear any flatness, that means I'm over a bone or a very hard um, object. So I'm going to be percussing, spot 2, again, 3, 4, hearing resonance, 5, 6, 7, 8, 9, 10, 11, 12. Heard resonance all the way down. Next I'm going to auscultate. So I'm going to use the diaphragm of my stethoscope. So as we go, every time I'm going to diaphragm, and I'll also talk you through it. If you just take a deep breath, I will listen to the full inhale and exhale. If you do get tired at any point, go ahead and raise your left hand or just let me know. On my diaphragm, go ahead and take a deep breath. Good. Deep breath. Good. Hearing nothing. Good. Go ahead. Good. Comparing on each side. Spot 5. Go ahead. It's very good. Hearing nothing. Good. Hearing nothing. Spot 7. Nothing. 8. Nothing. Doing okay?
Yep.
Go ahead. 9. Nothing. Go ahead. 10. Nothing. Go ahead. I'm sorry, one more time. Very good. 11. Nothing. Good. 12. Nothing. So one sounds clear bilaterally. If I was hearing any wheezing, that'd be a sign of asthma, which you do not have. And then also, if I heard crackles, that'd be another indication for fluid buildup in the lungs. So now I'm going to use my first look at my paper. Okay. Flip that over again. You can go ahead and lay down. I'm going to switch the camera angle. Okay, perfect right there. So first thing I'm going to do before we get into our cardiac assessment, I'm just going to check for jugular vein distension. So I'm going to take away your pillow momentarily. If you could go ahead and look to your left. I'm looking right here. There's no distension of the jugular vein. Look towards me. Again, no distension of the jugular vein. If there was, here's your pillow pack. If there was, I would raise you up to a 45-degree angle, and then I would reassess if it was still there. So to begin, can I just have you lower your gown to about your midline of your stomach, or just above your belly button? Perfect. Good there, comfortable. Okay. I'm inspecting, feeling temperature. It's good all around. Skin is, her body is symmetrical. Skin is consistent all the way through. No abnormalities in lesions or rashes or any moles to be concerned with. So inspection is good. So what I'm going to be doing as a cardiac assessment, I'm going to be assessing five cardiac sounds. The acronym for this is APE to man. So I'm going to start with your apical valve, aortic valve up here. Let me slow down. Aortic valve up here. That's going to be on your second intercostal space. And on the left side, I'm going to go to the pulmonic second intercostal space, Erb's point, which is the loudest point of the body in the third intercostal space, tricuspid valve, fourth intercostal space, and then the mitral valve, fifth intercostal space, which is midclavicular, and then I'll be listening for a full minute for the aortic pulse. So again, I just want to reiterate that this is the right side closest to me, and then I'm going to start by listening with my diaphragm, and then I will listen for lub dub, S1, S2, and then I'll switch over to my bell, listening for any murmurs. So to start, I'm going to get my stethoscope ready. I'm on my diaphragm. I'm on clavicle, space, rib 1, space, rib 2, space. Going in with my diaphragm. I'm listening now. Hearing lub dub, S1, S2. Flipping to my bell, listening. Hearing nothing, no murmurs heard. So now I'm going to go on the left side, far side away from me. I'm going to feel our clavicle, space, rib 1, space, rib 2, space. I'm on my diaphragm to start. I am going to listen. Hearing lub dub, S1, S2. Going to flip to my bell. Hearing nothing, no murmurs heard. So now I am still on my second intercostal space. I'm going to go to rib 3, intercostal space 3. Now this is Erb's point, the loudest pulse we can hear. So I'm on my bell still, listening. No murmurs heard. I'm going to flip. Hearing S1, S2, lub dub. Still on intercostal space 3. I'm going to now go to, I'm going to recount because I lost my spot, which is okay. Clavicle, space, rib 1, space, rib 2, space, rib 3, space, rib 4, space. So now I'm on my diaphragm. I'm going to place my diaphragm where my finger was. Listening. Hearing lub dub, S1, S2. I'm now going to flip my diaphragm to my bell. Hearing nothing, no murmurs heard. Still on space 4, I'm going to go to rib 5, space 5 here. I'm now going to switch my finger underneath. And then I'm going to go mid-clavicular down the nipple line over. And this is the mitral valve. So here I'm going to listen for a full minute to the apical pulse after I listen with my bell. Listening, not hearing anything, no murmurs heard. Flipping to my diaphragm. Listening for a full minute. Apical pulse was 74. Cover you back up. Thank you. Okay. So now I'm just going to switch the camera angle to assess your abdomen. We are still recording. Perfect. Okay, if you could just lift your gown up for me, just above your abdomen line there. Perfect, and then we'll lower this a little. Good. Okay, so what we're going to do with abdomen, so there's a very specific order we need to go in. First, we need to inspect, then auscultate, percuss, light palpate, deep palpate. So first with inspection, I am seeing symmetry on each side, no discoloration in the skin. I'm seeing no abnormal lesions, rashes, or moles. And then I'm going to get down at eye level, looking for the aortic pulsation. Could you just hold your breath for a moment? Perfect. And now I'm going to make sure that I'm seen at the end of the bed. And then could you do the same thing? Just hold your breath for a moment. Seeing the abdominal aorta pulse. Fixing the camera angle. So now that we've inspected, we're okay to go ahead and auscultate. So I'm going to listen with the diaphragm for bowel sounds. I'm starting the right lower quadrant, go to the right upper, clockwise down to the left lower. Then after that, I'm going to find the abdominal aorta, listen to that for bruits, go down to the renal arteries, each side, and then the iliac arteries. I'm going to compare. Then I'm going to percuss, same order as the auscultation, listening for tympany. And then I'm going to percuss up to the liver to find out where that is. And then once I go, I'm going to hear tympany until I hear dull of the liver. Then after that, I will light palpate, and then same order as the auscultation, percussion, and then deep palpate. So to begin, I'm going to start with auscultation of the right lower quadrant. I'm on the diaphragm, and I'm going to listen for bowel sounds. Hearing 5 bowel sounds, gurgle, gurgle. Going to the right upper. Hearing 5 bowel sounds, gurgle, gurgle. Left upper. Hearing 5 bowel sounds, gurgle, gurgle. Left lower. Hearing 5 bowel sounds, gurgle, gurgle. So bowel sounds are active ×4. I'm now going to switch to my bell, and I'm going to be listening for the arteries for any bruits. So I'm going to find your xiphoid process up here, go to your belly button, midline of that, and I'm just going to listen to your abdominal aorta for any bruits. Again, I'm on my bell, listening, hearing nothing, so no bruits heard. So now I'm going to go down slightly to the diagonally above the belly button umbilical for the renal artery. Hearing nothing, no bruits heard. Comparing the other side. Hearing nothing, no bruits heard. Now I'm going to move down again to the iliac artery. Hearing nothing, no bruits heard. Comparing the other side. Hearing nothing, no bruits heard. So that will complete our auscultation for your abdomen. We will have one more auscultation once we get to the femoral artery. But now we are okay to move ahead and percuss. So I'm going to start with the right lower quadrant. I'm going to go clockwise. So I'm going to start here. Hearing tympany, right upper. Tympany, left upper. Tympany, left lower. Tympany. Now I'm going to assess or percuss down up to listen for your liver. Tympany, 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 dull. So liver is about right there. No distension of the liver seen, so that is good there. Next, we're going to do light palpation. If you feel any pain or discomfort with this, let me know. So palpating lightly, right lower, right upper, left upper, left lower. Any pain or discomfort with that?
No.
Okay. Now we're going to go a little bit deeper. Right lower, left or right upper, left upper, left lower. Any pain or discomfort with that? No? Okay. So after we palpated, that will complete our abdominal assessment. So you can go ahead and cover up until your waistline because we'll have to do the femoral artery. I'm just going to go ahead and flip the camera over to make sure it's seen. Okay, now I have sight of all of your waist down to your legs. So what we're going to do here is we're going to assess your pulses. So we're going to start with your femoral arteries. We're going to compare for strength and symmetry, and then we're going to do your popliteal, and then your post tibialis, and then your dorsal pulses. So first, could you just make kind of like a frog-like positioning here for your arteries? Okay. So I'm just going to reach in here, find your iliac, and I'm going to go in a little. Okay, I'm feeling right here. So I'm going to hold that. I'm going to do the same thing here. Find that, move in, feeling. Pulses are strong and symmetrical. Next, I'm going to hold my spot and I'm going to listen for any bruise here. Again, I'm with the bell. Just going to put that in. I'm listening right here. Hearing nothing, no bruise hurt. Okay, I'm going to refine my spot over here. Feeling that, going in. Good, feel it. Putting my bell on it. I'm listening right here. Listening. Hearing nothing, no bruise heard. Okay, you can go ahead and lay normal now. So the femoral artery is good. We can cover you up a little bit more now. So now I'm just going to inspect your legs. Muscle symmetry is good. Muscle tone is good. I'm not seeing any abnormalities in the skin. Temperature is good. No rashes, lesions, or moles to be concerned about. I do see a little scar here. What happened with that?
It is not a scar, it's a birthmark.
It's a birthmark? Oh, I'm sorry. Birthmark, okay. And then, so we will now assess your popliteal arteries. Is it okay though if I take your socks off so that we can move down there? Okay, put your socks up here. Good. Okay. So now if you just bend your knees, just like that, spread them out a little bit. Just gonna feel in here, right in between those two. One more time. Okay, feeling your popliteal arteries or pulses are strong and symmetrical. So you can go ahead and put your legs down again. Could you actually scoot up on the bed just a little bit for me? I'm just gonna check the camera angle now. Feet are still in there. Okay. So I'm just gonna spread your legs apart a little. Feeling for your post tibialis pulse. Pulse is strong and symmetrical. Next thing, your dorsal, which you just kind of follow here. Feeling. Dorsal pulse is strong and symmetrical. Okay, so a couple more things with your legs, and then we'll move to sitting up. So first thing is, I just need to check in between your toes. Do you have any problems with your feet or any pain ever?
No.
No? Okay. So same thing here, we're going to check cap refill. And again, it's going to check perfusion towards the extremities of your body. So I'm just going to check. Cap refill is symmetrical, less than 3 seconds, symmetrical, less than 3 seconds, and symmetrical, less than 3 seconds. So cap refill is good, between your toes is good, all your pulses are strong and symmetrical. So one of the final tests that we're going to do is we're going to do point location test on your legs, sharp and dull. So if you could just close your eyes for me, I'm going to put sharp down, and so this is sharp, and then this is dull. Feel the difference? Okay. Okay, so I'm going to put either sharp or dull on either side. You just tell me where it is. For example, sharp, right thigh. So go ahead and close your eyes.
Dull.
Where?
Left thigh.
Okay. Could you just speak up a little more? Right, or start that over. Okay. Tell me where this is.
Sharp left calf. Dull right calf. Sharp left knee. Sharp right knee. Sharp left thigh. Dull right thigh. Dull left foot. Dull right foot. Dull bottom of my foot. Dull bottom of my right foot.
Perfect. Okay, so your sensory is good on your legs, so you can cover you up here. So there's no concern for neuropathy there. So I'm now going to use my second sheet check. Make sure that I'm seen. Examine patient, GVT, chest, suspect scan, arm diaphragm. Okay. I just wanted to know no edema in the legs seen. Okay, so we're going to go ahead. If you could just sit up without getting off the bed quite yet, just where we began the test. And I'm just going to move the camera back to where we were at the beginning. Yeah, look at those just a minute. Okay, so with the legs, we're just going to do a little bit of range of motion test and then patellar reflex. So could you go ahead and kick your leg out forward? Good. Same with the other leg. You can put them down, sorry. And then now we're going to check the patellar reflex. If you could close your eyes, I'm going to find it and then give you a little thump on the knee. Oh, we'll try that again. Good. Try this one. Good. Okay. Next, we're going to do a little range of motion exercise. Could you go ahead and rotate your ankles? Rotate them the other way. Good. And now I'm going to push down, you push up just like the hands. Good. Down. Good. Out now. Good. And then in. Good. So range of motion on the legs is good. You can go ahead and put your socks on. Do you need any assistance with that?
No, thank you.
Okay. I'm just going to make sure that the angle had your feet. Okay.
I need shoes.
Shoes as well. Just one shoe. Could you go ahead and tie those as well? I could tie them if you needed.
Thank you. Oh, shirt's coming.
I will help tie that in just a moment. I'll tie this shoe for you.
Thank you.
Loop, swoop, and pull. Let me tie this for you. And then, as we set up, were you feeling any dizziness or lightheadedness?
No.
Okay. Just can tie one more for you here. Okay, so you can go ahead and stand up. Are you feeling any dizziness or lightheadedness again?
No.
Okay, I'm just going to check the camera angle one more time now that we are standing. Good. Okay, so we're going to start with the Romberg test. So what we're going to do is I'm going to have you close your eyes, feet shoulder width apart. Close your eyes, and I'm just going to hands out to the side. I'm going to stand here for 10 seconds. Good. I did not see any swaying or loss of balance. You're good to relax now. So I'll give you a negative Romberg test, and that was also a test of your cranial nerve number 8, which was your gait and balance. So next what we're going to do is we're going to take a couple steps that way. Once I say so, I'm going to walk next to you in case you do lose your balance and start to fall. We're going to walk normally, and then on the way back, we're going to take a couple, or on the way back, we're just going to go heel to toe. So if you go ahead and walk normally this way, feeling okay with that?
Yep.
And then heel to toe on the way back.
Like this?
Should have demonstrated that. Still feeling okay?
Mm-hmm.
Okay. So you're okay to go ahead and sit down if you'd like. Any questions for me before I give you a Braden scale? No. Okay. So I would give you a perfect score of 23 on the Braden scale. I do not see any issues with incontinence, any chance of shear and friction. Your mobility is good, which is your ability to turn over in bed. Your exercise is good, or activity, and then so the Braden scale is a test of a risk for pressure ulcers. So 23 is a perfect score, so you have no risk for pressure ulcers. Again, any questions before we finish? Oh, okay, I'm going to use my third and final sheet check. Make sure that I got everything at the end there.
You make sure the camera's still okay.
And done.